Just as so many of us thought things were headed in the right direction, the spread of COVID-19 is once again rising in our community. The number of hospitalized patients is higher than it's been in months, and the positivity rate shows us that more of our friends and neighbors are getting infected. And of course, there's the added concern as our children head back to school. All of this as there is movement when it comes to vaccinations. The FDA gave full approval of the Pfizer vaccine, what is hopeful to serve as a major step in convincing those with hesitations to get the life-saving vaccination. Here to answer some of the top questions we are getting from the community is Dr. Sullivan, an infectious disease doctor with us here at Spectrum Health. Dr. Sullivan, thank you. First, your perspective on what we are seeing at this moment in the pandemic.
Well, I think it's pretty clear that the infections are rising. You know, like if we go back 4 to 6 weeks back to the beginning of July, mid-July, we had around 20 to 30 COVID patients in the hospital. Now today we're up over 100 all across our Spectrum Health West Michigan hospitals. And our percent of positive tests in the community has risen from around 2.5% to 3.5% during this time to the last week average we're 9.8%. So we've had several days where we've been over 10%. And I think what's pretty crystal clear is that this spread is being fueled by the Delta variant. You know, that started to really spread in the southern part of the United States, and now it's crept into the northern parts of the United States, and that is responsible for almost all the cases we're seeing right now of COVID-19 in the state of Michigan and, you know, the country for that matter.
And one of the leading questions we get is about these breakthrough infections, those who have had the vaccine but still managed to get COVID-19. How often are we seeing those?
So we don't see them very often. They're still rare. I would say, you know, we do have patients in the hospital who've been vaccinated that have test positive for COVID-19. I would add that when you really start looking at the numbers, though, half the people who are admitted to the hospital with COVID-19 and have been vaccinated, it's an incidental discovery. They're admitted for trauma, for you know, a bleeding gastric ulcer, something along those lines. But because we screen all patients when they come into the hospital for COVID-19, we oftentimes will pick up completely asymptomatic infections, and about half the vaccinated patients who are testing positive for COVID-19 fit in there. Then the other group of patients, we do have some vaccinated patients that are sick, you know, but when you start looking at those numbers, you begin to see that most of the vaccinated patients who are sick with COVID-19 and need hospital admission, they oftentimes have some underlying condition that makes it likely they did not have as good a response to the vaccine as a normal person would, like they're immunocompromised, they're taking medications that might interfere with it. It might be age, because as we all age, our immune system doesn't work quite as good as it used to when we were younger, and the effect of a vaccine can wear off a little quicker as we age as well. So there's a variety of reasons why people who are vaccinated might potentially end up in the hospital. Fortunately, though, those continue to be very, very rare events, and the vast majority of breakthrough infections that we see do not end up in the hospital, and they have very mild asymptomatic or milder asymptomatic disease, and it keeps people out of the hospital. So despite the fact that we're seeing infections in vaccinated patients, the vaccines are doing their number one job they were designed to do. That is, keep people out of the hospital and keep them from dying and getting severely sick.
We get lots of questions about the Delta variant. It's been mentioned a lot in the news. Do we test for the Delta variant in our hospitals? And what do we know about the efficacy of the vaccines against the Delta variant?
So variant testing is actually very technically intensive testing and requires a lot of instrumentation that a normal clinical laboratory in a hospital, such as our hospital or other big hospitals, do not have. So all the variant testing is done by the state of Michigan. We send a random sampling of positive COVID-19 tests to the state every week, and the state does variant testing on it. We can also request it, like if we have a specific case that we want tested for variant testing, we can also send that to the state of Michigan. So the state is doing all the variant testing right now. Suffice to say that, you know, right now, the bulk of the positive COVID-19 cases across the state are due to Delta. Now, with regards to Delta and vaccines, you know, people are probably hearing a lot of stuff in the news about Delta and vaccines, and, you know, the efficacy of the vaccine or the effectiveness of the vaccine against symptomatic disease, like just developing symptoms, is definitely lower with the Delta variant than it was with previous variants. We are seeing a little bit more symptomatic disease than we would with the previous variants like Alpha and a couple of the other ones. The vaccines, all of them, be it Pfizer, Moderna, or Johnson & Johnson, are more than 90% effective at keeping people out of the hospital even when they're infected with Delta. Johnson & Johnson, we don't have as good a data as we do with Pfizer and Moderna, just because there's only been, I think, around 14 million people vaccinated with Johnson & Johnson compared to Pfizer and Moderna, where it's much, much higher. So we have much better data with the Pfizer and Moderna vaccines. But even the Johnson & Johnson vaccine is holding up very well against the Delta variant and keeping people out of the hospital.
For those who have had the COVID-19 virus, is the vaccine still necessary for them?
You know, I would think it is. You know, I definitely think it is. You know, one of the things is there's no doubt that reinfections are not very common. That being said, Delta seems to be changing everything. There is mounting evidence, starting with a CDC study in Kentucky recently, that showed people who had a previous history of COVID infection and did not get vaccinated were almost two and a half times more likely to get reinfected if they did not get vaccinated. And that was due to the Delta variant. And so Delta's sort of rewriting some of the rules, and Delta seems to have a more higher ability to cause breakthrough infections. You know, and it stands to reason that if Delta can cause breakthrough infections in a person who's been vaccinated, there's no reason to think it's not going to be able to cause breakthrough infections in people who are not vaccinated and have a history of COVID-19 infection. So Delta's definitely changed some things. And I think that anybody who's had COVID-19, when you get if you choose to get vaccinated and you do get vaccinated, that is going to give you a much, much higher degree of immunity. Studies show that when people who have had COVID-19 get a shot of vaccine, a series of vaccine, their numbers of neutralizing antibodies and other markers of immunity are really, really high, and it augments their immunity that they've already had very well, and offers a very high level of protection against infection from any of the circulating variants.
Let's talk about masking. There is a lot of frustration there. Why have we reverted in many cases to the suggestion, and in some cases the requirement, of having even vaccinated people wear masks?
So again, this is where Delta comes in. Delta, the rule breaker that it's been, and it's, like I said, rewritten a lot of rules. Studies, it's very interesting, studies have shown that when vaccinated patients get infected with Delta, the amount of virus that replicates in their respiratory tract is almost as high, or as high as those of people who are unvaccinated that get infected with Delta. So the concern is that people who have gotten breakthrough infections with Delta, or even are asymptomatic and don't know they're infected with Delta, have the potential to spread the virus to people around them with just as much ability as those who are unvaccinated. Now, one of the biggest questions remains, how long are they contagious? And there's some preliminary evidence that suggests that vaccinated people probably aren't as contagious as long as unvaccinated people, but that is still being intensively looked at, and we don't quite know the answer to that question yet. So I think that is what spurred CDC to make a recommendation that vaccinated people, when they go into situations where there's crowding, where they can't socially distance, where ventilation is poor, that they put a mask on to even further lessen, you know, they're already highly protected with the vaccine, but then putting a mask on adds an extra layer of protection to prevent them from getting sick. And more importantly, to be honest with you, if they're inadvertently sick and they don't know it, it really substantially cuts down on the amount of virus they potentially could spread to people around them that may be unvaccinated or vaccinated alike. So I think that's where the push to start masking again in certain situations has come from. And it's probably the prudent thing to do right now, because as we can see, community spread has markedly increased, and there's going to be some situations we're all going to find ourselves in where it may be a little bit more risky to catch infection than other ones. And it's probably a good idea to carry a mask with you and put it on in certain situations, regardless of your vaccination status.
There is a lot of discussion right now about another shot, a booster dose to help those who are already vaccinated. How does this help?
So what boostering does is, the idea behind that is that, so you've gotten a 2-shot series already that were 21 or 28 days apart. You've attained a really good immune response. And so studies are showing that people maintain a really good level of immunity for at least 8 months, but then studies are starting to show that the immunity appears to be starting to wane. The idea is to give another shot of the same vaccine that you received before, not an updated vaccine, but the same one. And studies are showing that when they give these people a shot of, for instance, the Pfizer vaccine, where you've completed a 2-shot series already, and 8-9 months later you get a 3rd shot of Pfizer, it really provides a significant boost to your immunity, and mostly in the form of what are called neutralizing antibodies, which are very important to help clear the virus from your body. And so the idea is to really augment and boost your immunity to a much higher level than you had, and to help offer further protection from getting infected.
Another question that we continue to get a lot of, and I know we have had since the beginning of the vaccination process, is how can you be so sure that this vaccine is safe when it's only been around for less than a year?
You know, it's a very common question I get, and you know, a lot of people ask about, well, you know, there's no long-term safety data. They are correct on that. I'm not going to argue that point. None of the vaccines have been out for 12 months yet. But I will say this, if you go back and look at the history of vaccine trials, and you look at the ones that have been successful versus the vaccines that have not been successful, whenever a vaccine gets derailed and either removed from the market or doesn't make it to the market in the first place, it's because of side effects that have happened within the first 6 to 8 weeks, and usually it's within the first 4 to 6 weeks. I'll give you a perfect example, rotavirus vaccine. The first rotavirus vaccine that came out, the one that is not in use today, but one came out in the 1990s. And in clinical trials, it looked like it was doing okay and not having any major problems. But then after they started to roll it out to millions of people worldwide, they started to see problems with a severe side effect in the gastrointestinal tract that was unfortunately causing a high amount of deaths in infants, because that's who rotavirus vaccine or rotavirus infection affects most, is infants. And so and it always happened within the first 4 weeks of receipt of the vaccine, so they removed the vaccine from the market. And if you look at clinical trials of vaccines that have failed in the past, that's why they've failed, because of something that has happened within the first 4 to 6 weeks. If vaccines don't have side effects within the first 4 to 6 weeks, you don't see them later on. The major reason vaccine trials go on for a long period of time is obviously safety is always going to be paramount. They never stop looking at safety during a vaccine trial. But the biggest reason you have to have a 5-year trial, there's 2 big things. Number one, you got to recruit enough people to get in the trial. And sometimes with some diseases, it takes quite a while to recruit enough people to get a trial to the size where you need to prove your statistical analysis and to get a good analysis for how good the vaccine is going to be. And then more importantly, we got to figure out how long are the vaccines going to work. You know, shingles is a good example of that. The shingles vaccine that was approved, you know, about 10 years ago or so, maybe not quite that long ago, that trial lasted 5 years. And the major reason it lasted 5 years is we wanted to know how long after people get the shingles shot can we expect them to have protection against shingles. And that's the biggest reason why vaccine trials go on for so long. Is the only way to answer that question is by studying the people who've received the vaccine versus the people who received the placebo shot and seeing how long those people who've been vaccinated are protected from the disease they are trying to prevent in the first place. And the COVID-19 vaccines are no different than that. The trials are still ongoing. They're still gathering data on safety. They're still gathering data on effectiveness. You know, I think when you start looking at the COVID-19 vaccines and the safety data we've accumulated with the hundreds of millions of people who've received doses of these vaccines, yes, there have been a couple of safety problems. I think FDA, CDC have been very good about catching them. You know, the thrombosis with thrombocytopenia syndrome in the J&J vaccine, and then the myocarditis, pericarditis syndrome with the mRNA vaccines, and the certain segments of populations where we've seen that. They've done a very good job with it. They've sent out good warnings about it. But by and large, otherwise, we have not seen long-term safety effects from these vaccines other than the normal side effects that we see in clinical trials. And I would argue, too, if you look at the history of vaccines, there have been no vaccines that have been under as much scrutiny and a microscope as these vaccines. You know, the measles vaccine didn't get this scrutiny, polio didn't get this scrutiny, shingles didn't get this scrutiny. Everybody, and I mean everybody across the whole world, is watching these vaccines, and they're looking at this so closely, and every little thing is examined in nauseating detail, to tell you the truth, at times. And so they are really looked at under a microscope more than anything else. And what's amazing about it is that their overall safety record has been nothing short of excellent.
How significant is this FDA approval that was announced this week?
You know, hopefully it's going to be very significant. I think it's obviously significant for the fact that now the vaccine is fully licensed. And so any argument that people have made in the past that it was experimental, it is no longer experimental. Truth be told, it wasn't experimental when we were using it under emergency use authorization. But now you can pretty much put that to rest completely. And hopefully by getting full vaccine approval or full approval from the FDA, that will help at least some of the hesitant people put their minds at ease, okay, that this has been looked at more, that all the I's have been dotted and the T's crossed, and that the agencies that look at vaccines have signed off on this and feel that it is ready for full licensure and approval, and hopefully it'll help motivate them to get vaccinated.
There's no doubt that there's fatigue when it comes to this for our team members here at Spectrum Health and for the community at large. I'm curious as to what keeps you going, and the most pressing question I'm sure you get is, do you think we will ever get out of this?
So fatigue, COVID fatigue, is a very real thing. You know, I would add to the public, we understand you guys are tired of all this, but I will say this, the healthcare world is just as tired. We are absolutely exhausted right now because there has been no, I've been doing infectious disease for 9 years. I think it is pretty safe to say there has been no more challenging 18 months in the past 18 months I have practiced medicine. It has been challenging on a number of fronts, physically, emotionally, mentally, et cetera, trying to keep up with all the data that we see all the time, trying to keep up with all the changing recommendations, taking care of patients, et cetera. It has been extremely hard on all of us. And there is no group of people who wants this to end sooner than the healthcare world. And I think what motivates a lot of us is we still have this burning desire inside of us and this mission we feel to take care of patients and to try to help them feel better and do the best we can and to give back to our communities and to give back to society and contribute in some meaningful way. I know that's what I do. I love infectious disease. I know that sounds kind of weird, but most of us infectious disease specialists sort of have a little bit different take on this. That being said, I don't want to see people die of COVID-19. I don't want to see people get sick from COVID. I want them to live a happy and healthy life, and I would love to see them not get infected with this virus, and if they do, to not have to get to the hospital. Will we ever see an end to this? Of course we're going to see an end to this at some point in time, but I think if the COVID-19 pandemic has proved anything, it's that it's unpredictable. When this is going to end is anybody's guess. Hopefully we're closer to that than we are farther away, but honestly, I don't know. This thing is coming in waves at us, and it's been really a tricky virus to deal with, and it continues to throw curveballs at us, and it's probably going to, at least for the foreseeable future. And I will add that, when you go back and look at the history of viral infections in humans, we have never, ever defeated a virus and ended a pandemic from a virus without vaccination, mass vaccination of people. Smallpox, polio, measles are 3 primary examples. The only way those pandemics ended was through mass vaccination of the human population. COVID-19 is not going to be any different. It's never going to leave us. It's here to stay forever. But our goal is to make this, instead of a severe respiratory infection that could cause severe illness and potentially death, make it into a very mild respiratory tract infection that will keep you out of the hospital and not cause severe illness and be a very short duration. And so, I wish I had a crystal ball and answer to when this is going to end, but I don't know. But we just have to keep doing our best, and we got to hang in there and do all what we can to prevent spreading the virus from person to person. And the number one thing we can do that is to get vaccinated.
Dr. Liam Sullivan, part of our infectious disease team here at Spectrum Health, thank you so much for your time today and your energy and leadership in helping our community get through this.
My pleasure. Thank you for the opportunity of having me speak.
For more information about COVID-19, visit spectrumhealth.org and search COVID.